So we'll begin with what is Medicare, a federal health insurance program for eligible U.S. citizens and legal residents. It's funded in part by taxes you've paid into while working. You fully vested after 40 quarters or 10 years. And it is individual health insurance. It's not a family plan. Each beneficiary stands alone on their own plan. Medicare is not free. It's not a family plan. It's not Social Security, and it's not Medicaid. Medicare is what you're paying into as an employee and a beneficiary or future beneficiary. Medicaid are some social welfare programs that help support people in need. So if you think of the word aid is the social program versus Medicare is something that we all eventually will be entitled to as long as we're paying into the system, or we have a spouse if we're a homemaker who's paid into the system. So what is Medicaid? It's a state government program that helps pay healthcare costs for individuals, families, and children with limited income and resources. Programs vary from state to state, but do follow federal guidelines for benefits. Eligibility varies from state to state. Now, I know with Brophy managing your money, there's probably not a lot of you that do qualify for Medicaid, but it's in here. And sometimes we have children that have maybe disabilities or health issues where they are eligible for Medicaid, even if you're not. Medicaid and Medicare can work together. We call this dual eligibility. And there are quite robust programs for those who qualify for both. So who can get Medicare? U.S. citizens and legal residents. Legal residents must live in the U.S. for at least 5 years in a row, including the 5 years just before applying for Medicare. You must also meet one of the following requirements. You're age 65 or older, or you're younger than 65 with a qualifying disability. Typically, if you get disability, then you're eligible after 24 months on disability, with the exception of if your disability is due to end-stage renal disease or ALS, you're immediately eligible for Medicare. So the question is, can we have both Medicare and Medicaid? Yes, some people are eligible for both Medicare and Medicaid. Dual eligibility, Medicare and Medicaid can work together to mitigate your health care costs. There are probably 10 different levels of eligibility for Medicaid. It's a whole